We have considered the causes of deafness in general and are going to look in a little more detail at some of the preventable causes of permanent deafness. These are well documented, but this does not prevent hundreds of thousands of individuals being affected each year. Ototoxicity literally means ear poisoning and refers to damage to the auditory system, the vestibular, the balance system. Such damage is the result of exposure to drugs, chemicals or heavy metals and may affect individuals at any age. Such damage may include loss of hearing, development or increase in tinnitus, ringing in the ears, and balance problems. It is estimated that 3 to 4% of deafness in children in low middle income countries is the result of the use of ototoxic drugs during pregnancy. Aminoglycosides may be used during pregnancy to treat severe bacterial infections. Inappropriate and indiscriminate use of aminoglycosides, such as streptomycin, is recognised as a major challenge. Many of these drugs are freely available in some countries over the counter, allowing individuals to self-medicate whilst unaware of the potentially devastating effect on the unborn child. Additionally, professionals and paramedics may be unaware of the hazard to hearing such drugs present. After almost 7 decades in clinical usage, aminoglycosides remain indispensable for the treatment of acute infections. However, overuse of aminoglycosides has long been recognised as a significant challenge by the World Health Organization. Damage can result in severe deafness and balance problems. A range of drug categories are potentially ototoxic, and for a detailed breakdown, please refer to this website. This also provides a table explaining drug groups and the relationship to determinants and risk factors. Some groups are at specific risk. Those who have a personal or familial susceptibility, the very young or very old. The factors that predetermine susceptibility to ototoxicity are pregnancy, renal or kidney failure, hepatic, liver failure, noisy work environments, and the use of aminoglycosides with other ototoxic drugs, particularly diuretics or water tablets. Aminoglycosides are widely used in South Asia, some parts of Africa and South America to treat a potentially fatal parasitic disease. They are also recommended as a second-line anti-tuberculosis (TB) treatment when first-line drugs have failed. We must remember that TB affects 1/3 of the world's population, with 1.3 million deaths per year. Thus, the importance of aminoglycosides cannot be underestimated. It is the careful dosage and duration of dosage that require monitoring. Public awareness of the risk of ototoxic damage is a key factor in reducing this preventable cause of permanent deafness. The use of solvents. Solvents are widely used in industry. Many workers are exposed to a mixture of solvents at the same time. Organic solvents have been demonstrated to have effects on humans with damage to the auditory system. For a full discussion, see Fuente and McPherson. Solvents noise. In addition to the ototoxic effect exposure to a mixture of solvents, there is evidence that where solvents and noise are mixed, the synergistic effect is significant. For example, workers exposed to toluene and noise in the manufacture of adhesive materials were estimated to be 10.9 times greater risk of hearing loss than workers who were only exposed to noise. For many of those working in low and middle income countries, exposure to solvents and/or noise is commonplace, with the long-term implications for their hearing health. Pesticides. While there is little research into the effect of pesticides on the auditory system, 16 studies suggest a clear link between the use of ototoxic pesticides and hearing loss. Pesticides are widely used in the production of coffee, cotton, bananas, rice, melons, flowers and vegetable, with the largest importer of pesticides being Brazil. Underdiagnosis, undernotification are widely acknowledged for acute cases. The limitation is even higher when it comes to the assessment of the chronic effect of pesticides, which is explained by the gradual increase in consumption and intensification of such use of substances in Brazil. Preventing pesticide-induced hearing loss. Ferenczi and McPherson point out that in low and middle income countries, farmers are vulnerable as is a lack of legislation to protect them, lack of enforcement, poor access to technical or laboratory facilities, inadequate pest control policies, and under-resourced research facilities. Farmers may have inadequate storage and use domestic areas to store pesticides, thus leaving family members open to the exposure of ototoxic materials. A number of agencies are working in this area to improve understanding and manage health and environmental impact of pesticide use. Currently, many low middle income countries lack technical knowledge in the area of toxicology. Until such areas can be addressed, the many health risks associated with the overuse of pesticides, including hearing health, will not be addressed. Heavy metals such as mercury, cadmium, lead and arsenic are not metabolised by the body. These metals accumulate in the soft tissue, causing toxic effects. In 2005, the World Health Organization reported that air pollution that resulted from traffic was the main cause of lead exposure in the urban populations in Pakistan. Lead exposure, even at low levels, can cause permanent hearing loss. Cadmium is found in nickel batteries, PVC plastics and paint pigments. And in animal studies, cadmium causes cochlear dysfunction, which is related to dosage, and this causes permanent deafness. Arsenic is released by the smelting of lead, zinc, copper, as well as in the manufacture of chemicals and glass. In overexposure, arsenic causes permanent hearing loss. The ototoxic effect of drugs, chemicals and heavy metals are known. It will require an educational programme to inform the public of the potential effect. Industry will need to work with hearing conservation plans, and those working in agriculture need to have access to and be protected by enforced legislation. Given the complexities of economic pressures, it is difficult for countries to place long-term benefit in place of short-term economic gains. Educational professionals working in the health sector can be more rapidly addressed, but ensuring there are sufficient specialists in this complex field is much more challenging. Until this can be addressed, millions will remain affected by ototoxic agents, leading to preventable hearing loss and other health-related problems.